Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Begin with a simple image. A person sits at a desk, shoulders tight, jaw clenched, breathing shallowly, with a glass of mineral water nearby. Most people would look for a stronger intervention first. A supplement, a breathing app, a vacation, a medication, a dramatic lifestyle reset. But pause, look at the glass. Ask a better question. Why might something as quiet as mineral water influence the stress response? How can water with dissolved minerals speak to the nervous system, the bloodstream, the muscles, and the brain? Do not think of mineral water as magic. Think of it as physiology in a bottle. In the United States, water labeled as mineral water is not just ordinary water with a glamorous name. It must contain at least 250 parts per million of total dissolved solids, come from a protected underground source, and have no minerals added afterward. That means its character comes from geology: rock, time, pressure, and underground filtration. In a sense, when you drink it, you are drinking water that has carried minerals through the earth before it reaches your body. Now ask, why does that matter for stress? Because stress is not only a feeling. Stress is electrical activity, hormonal signaling, vascular tone, muscle contraction, sleep disruption, digestive disturbance, and attention under pressure. It is the hypothalamic pituitary adrenal axis, the sympathetic nervous system, cortisol, adrenaline, thirst signals, sodium balance, magnesium balance, and cellular energy demand. So do not reduce stress to being worried. Respect it as a whole body event. And then ask, how can mineral water help? It may help in 3 practical ways: by improving hydration stability, by supplying small but biologically meaningful minerals such as magnesium and calcium, and by creating a calm behavioral ritual that interrupts the stress loop before it escalates. First, command your attention toward hydration. Do this. Notice what happens to your mind when you are even mildly underhydrated. Your mouth dries, your head feels heavier, your patience shortens, your concentration narrows. Why? Because water is part of blood volume, temperature regulation, cellular function, and neuroendocrine signaling. Your brain does not float above the body, it reads the body continuously. A 2014 study in Pilo-Oni examined adults who habitually drank low or high amounts of water. When low-volume drinkers increased water intake, fatigue and confusion decreased. When high-volume drinkers reduced water intake, calmness, contentedness, positive emotions, and vigor declined. Do not miss the practical message. For some people, mood is not only psychological, it is partly hydraulic. The emotional tone of the day may shift when water intake becomes more stable. Now ask, why mineral water rather than only plain water? Plain water is valuable. Drink it. But mineral water brings something additional: dissolved electrolytes and minerals that can support fluid balance and neuromuscular function. Magnesium is especially important here. The National Institutes of Health describes magnesium as a cofactor in more than 300 enzyme systems, including processes related to muscle and nerve function, blood glucose control, blood pressure regulation, energy production, and the movement of calcium and potassium across cell membranes. Adult recommended intakes generally fall around 310 to 420 milligrams per day, depending on sex and life stage, and water can contribute variable amounts depending on the source and brand. How does that connect to stress? Consider the stressed body. Muscles tighten, the heart beats faster, nerves fire more readily, sleep becomes lighter, the gut may become reactive. Magnesium is involved in the regulation of nerve excitability and muscle contraction. It also interacts with systems linked to the stress response, including the HPA axis. A systematic review in Nutrients reported that evidence for magnesium reducing subjective anxiety is suggestive but not conclusive, and it emphasized that better randomized trials are still needed. That caution is important. Say it clearly, mineral water is not a sedative, not a psychiatric treatment, and not a replacement for care. But the mechanisms are plausible, and the clinical literature gives us a serious reason to pay attention. Now ask another question. How can a small amount of magnesium in water matter if food provides more? Here is the overlooked point. Mineral water is not meant to replace food. It is meant to add a steady, calorie-free contribution across the day. A randomized crossover trial in food and nutrition research compared magnesium bioavailability from mineral waters, bread, and a magnesium supplement. The study found comparable bioavailability across the tested products, meaning magnesium from mineral water can be a usable source, particularly when the water is rich in magnesium. So take action. Read the label. Do not choose mineral water blindly. Look for magnesium content. Look for calcium. Look at sodium. If you are using mineral water for stress support, prefer one with meaningful magnesium and moderate sodium unless your clinician has advised otherwise. Why? Because some mineral waters are high in sodium, and that may not be appropriate for people with hypertension, kidney disease, heart failure, or sodium restriction. If you have a medical condition, do not guess. Ask your clinician. Now let us move deeper. Stress and hydration meet through cortisol. Cortisol is not the villain, it is a survival hormone. But when the body reacts too strongly or too often, recovery becomes harder. A 2025 clinical study in the Journal of Applied Physiology compared people with low habitual fluid intake to those with high fluid intake during an acute psychosocial stress test. The low intake group showed greater cortisol reactivity, and markers of suboptimal hydration, such as higher urine osmolality and darker urine, were associated with greater cortisol response. Ask yourself, how many times have we interpreted a sharper stress reaction as a personality flaw when the body may simply be underprepared? Use that information immediately. Do this tomorrow morning. Check the color of your first urine. If it is consistently dark, do not panic, but take it seriously. Begin the day with mineral water instead of waiting until stress has already tightened your chest and dried your mouth. Drink slowly. Do not chug. Let the first glass become a signal. My body is safe enough to regulate. Why slowly? Because the goal is not to flood the stomach. The goal is to create steady intake. The nervous system likes rhythm. Use a simple schedule. 1 glass after waking, 1 mid-morning, 1 mid-afternoon, and 1 early evening if it fits your needs. Adjust for exercise, climate, sweating, pregnancy, medications, and medical advice. Do not force excessive water. More is not always better. Too much water without electrolyte balance can be dangerous in extreme cases. Balance is the word. Now consider carbonation. Some mineral waters are still, some are sparkling. Which should you choose? Ask, how does your body respond? Sparkling mineral water can feel satisfying and may help some people replace sugary drinks or excess caffeine. That matters because caffeine overload and sugar swings can mimic or intensify stress sensations, palpitations, irritability, energy crashes. But if carbonation worsens reflux, bloating, or stomach discomfort, choose still mineral water. Do not follow a trend, follow your physiology. Next, connect mineral water to the mouth-brain ritual. When stress rises, people often reach for something fast. Coffee, sweets, salty snacks, scrolling, or another burst of stimulation. Replace one of those automatic responses with a structured pause. Command yourself. Stop. Sit upright. Relax the jaw. Breathe out longer than you breathe in, and take 5 slow sips of mineral water. Ask, why 5 sips? Because it is long enough to interrupt momentum. How does it work? Through behavior first, chemistry second. You create a micro-ritual that tells the brain, we are not running from a predator, we are regulating. Add 1 more layer, temperature. Use cool mineral water when stress feels hot, agitated, and restless. Use room temperature mineral water when your stomach feels tight or sensitive. This is not complicated medicine, it is body literacy. Learn your signals. When the body whispers, do not wait until it shouts. Now let us be medically honest. Mineral water will not remove grief, trauma, financial pressure, workplace overload, panic disorder, major depression, or chronic anxiety by itself. Do not place that burden on a beverage. If stress is persistent, disabling, associated with chest pain, fainting, suicidal thoughts, substance dependence, or severe insomnia, seek professional help promptly. Use mineral water as support, not as denial. But also do not underestimate small interventions. The body is built from small, repeated inputs. Sleep timing, light exposure, protein intake, movement, breathing, hydration, electrolytes, and social connection. Mineral water fits into that category. It is simple enough to do daily and biologically credible enough to deserve a place in a stress care routine. Here is the practical protocol. Choose a mineral water with a clear mineral analysis. Prefer glass when possible, or use bottled options responsibly and rotate with safe tap water if appropriate. Aim for consistency, not excess. Pair each glass with a brief downshift. Loosen the shoulders, unclench the tongue from the roof of the mouth, exhale fully, then sip. If you exercise or sweat heavily, consider mineral water after activity. If you take medications such as certain antibiotics, thyroid medication, or drugs affected by minerals, ask a pharmacist about timing. Minerals can interact with absorption. Ask again, why is this effective? Because it addresses stress from the bottom up. It supports hydration status. It may contribute magnesium and calcium. It may reduce reliance on overstimulating drinks. It creates a pause. It gives the nervous system repetition, and repetition is how regulation becomes familiar. Ask finally, how will you know it is helping? Track 3 signs for 7 days: afternoon fatigue, irritability, and sleep onset. Also track headaches, muscle tension, and cravings for extra caffeine. Do not expect fireworks. Look for quiet changes, a steadier afternoon, fewer tension spikes, a softer landing at night. The best physiological supports often do not announce themselves loudly. They simply make the day less jagged. So the message is clear: use mineral water intelligently. Do not worship it. Do not dismiss it. Place it where it belongs, as a practical, medically sensible support for a stressed body that needs hydration, minerals, rhythm, and a moment of recovery. Why choose it? Because stress is physical as well as emotional. How should you use it? Choose the right mineral profile, drink steadily, pair it with breathing and posture, and respect your medical context. Let the glass become a small daily agreement with your nervous system. I will not wait until I break down before I regulate. Take care of yourself and take care of each other. We are learning these tools together like a family around the same table. See you in the next topic.